after this, and we're going to be done. Body fluids, as we talked about previously, the body is made up of a lot of water. 50% to 60% of the body weight is water. That's why when the probes are going out, one of the things they always, one of the major things they always look for is water. And a lot of exoplanets have water, but they're in frozen form or other forms, but water is one of the things primarily they always look for if they're looking for life forms that are similar to us. We have fluid compartments. So think about this. We have two fluid compartments. One of them has two divisions, but we have two fluid compartments. We have a compartment inside the cell and a compartment outside the cell. So we have a compartment inside the cell and a compartment outside the cell. And the compartment inside the cell is obviously, as you can imagine, is called intercellular fluid, ICF. And that's responsible for 65% of all the fluid in the body is inside the cell. So remember, big overall concept, we have two compartments. It's either inside the cell or it's outside the cell. The other one we have is extracellular fluid, okay? We have extracellular fluid, which if the other constitutes 65, this constitutes 35. Now, in the extracellular fluid, it has two compartments. It has one, the interstitial fluid that surrounds the cell, and then it has the fluid that's inside the vascular system, okay? But that's still fluid outside the cell. So we have intercellular fluid that's responsible for 65% of the fluid volume. And then we have extracellular fluid, which has two components, interstitial fluid, because remember, most of the cells are surrounded by capillaries, but there's a space there, okay? And the space there is interstitial fluid. And so if I make a thyroid hormone, okay, in my thyroid gland, then that thyroid hormone is expelled, it's packaged up in the Golgi apparatus, fuses with the cell membrane, expelled into interstitial fluid, and then it's absorbed into the capillaries. Okay, it's absorbed in the capillaries. So it actually goes through both compartments of the extracellular fluid. So we have interstitial fluid, which is responsible for 80% of the fluid, and it's the space between the circulatory system and the cells. Okay, so this is a concept that some people never quite get, that they're each, most, number one, cells aren't flat. Some cells are flat, but most of the cells are, round in shape, and they're surrounded by a capillary network, but there is a space between the capillary and the cell, and that has a fluid-filled space, and it's called interstitial fluid. Okay, and so we have two compartments, interstitial fluid, which is 80% of that 35%, which you multiply 80 times 35, that's 28%. And then we have the plasma lymph, okay, fluid portion of the blood, which is contained in the circulatory system. So this is extracellular fluid. This is extracellular fluid. It is just in two compartments. So if you can remember that, that's a pretty good concept to remember. What is composition of the body fluid? A lot of the body fluid consists of electrolytes, okay? And electrolytes are primarily ions. We have a sodium ion there and a chloride ion. Remember, ions are elements or groups of elements that either have gained or lost electrons, and in the process have gotten a charge. Then the charge, if they've lost an electron, they got a positive charge. If they gained an electron, they got a negative charge. I know you had this in Anatomy and Physiology 1, and just started to review it. An ion is an element or group of elements that has either gained or lost electrons, and the process has developed a charge. So these are electrolytes, okay? These are electrolytes, they have a charge, and these are individual ions, okay? Individual ions, they're only made up of one element. Non-electrolytes are elements that do not dissociate in water, and primarily they're uncharged. And glucose is an example. And that doesn't mean that it's not hydrated, okay? Glucose is surrounded by water. just like sodium and chloride is surrounded by water. You can understand why sodium chloride is surrounded by water, because sodium has a positive charge. The water molecule has a partial positive and partial negative charge because it has a non-equal covalent bond, and so it surrounds sodium and chloride. But also glucose has water surrounding it, and glucose is a non-electrolyte because it doesn't associate into charged particles. However, both contribute to the osmotic gradient because they count as a molecule that is a particle in the blood. And also, when we talked about colloidal osmotic pressure holding water in, holding our filtrate in, this is why, is because these these particles are hydrated and represent a pulling of fluid towards them, or a holding of that fluid. And so both both electrolytes and non-electrolytes contribute to the osmotic gradient. Extracellular and intercellular fluid. When you took Anatomy and Physiology 1 and in Chapter 11, which I've just gone over with the other class, we looked at concentrations inside and outside the nerve because that's what set up the electrochemical gradient. But these are the same types of concentrations that are in most extracellular and intercellular fluid. In intercellular fluid, the sodium is low, and in extracellular fluid, it's high. In intercellular fluid, the potassium is high, and in extracellular fluid, it's low. In intercellular fluid, the chlorine is low, and in extracellular fluid, it's high, okay? And then proteins are high inside the cell, and they're high in the plasma, but they're low in the interstitial fluid. So proteins are responsible for primarily, they're the negative charge inside the cell, okay? And chloride is primarily responsible for the negative charge outside the cell in the extracellular fluid. And then we have sodium and potassium, which are, have different ratios, and that was responsible for our depolarization, repolarization when we looked at nerve transmission back a long time ago, whenever you took that. This is just a chart showing that. You can see that in more detail if you wanted to. Water gain and water loss. Water moves by osmosis. Osmosis is just a particular type of diffusion. Water moves by osmosis. Water is the movement, osmosis is the movement of water from an area of higher concentration of water to an area of lower concentration water through a semipermeable membrane down a concentration gradient, usually till equilibrium is reached, unless there's a reason not, but unless there's a physiological barrier to prevent equilibrium being reached. So it is a particular type of diffusion. Remember, general diffusion doesn't require any kind of membrane, okay? Doesn't require a membrane. So in the days when we were in lecture hall, somebody could come in and pop a can of sardines in the back of the lecture hall, and it wouldn't be very long for the people on the front row and me up at the front would smell the sardines. That's diffusion, okay? And that doesn't require a membrane, but osmosis is actually technically defined as movement through a semipermeable membrane. You will also have it defined as the movement from an area of low concentration of solutes to an area of high concentration of solutes. And so you'll see it defined in both ways, because if you think about it, if you have a high concentration of water, you have a low concentration of solids. So you have a low concentration of dissolved materials in that water. And so you have it defined in both ways. So just know that if you see it, but it is a particular type of diffusion. And we learned that last semester. Fluid deficiencies, so we can have dehydration. We live in Florida, so we experience that all the time. I play golf, okay? And my rule on a hot day, and I try not to play golf anymore on a hot day, is I drink a bottle of water every 3 holes, okay? I drink a bottle of water every 3 holes, and and then I just try to see if I can keep up, because it is hot out there. And you can get dehydrated, and you can get into heat exhaustion, heat stroke, before you realize it. And so it's really important in our particular environment that you be aware of dehydration. And so what you have obviously is water loss, okay? And you keep the salt, okay? You keep the electrolytes, keep the salt, and that increases the osmolarity of the extracellular fluid. That's ECF. ICF is intercellular fluid, ECF is extracellular fluid. And remember, again, we have two compartments. We have the interstitial fluid and the intervascular fluid in the ECF, okay? Causes, you can have fever and get dehydrated. You can have mental confusion, and you can have hypovolemic shock. These things will cause fluid deficiency. Okay, fluid excess. You used to you'd find somebody that would get into hypotonic hydration because they go around the gym and they carry the gallon of distilled water. Distilled water's got nothing in it, okay? And they read in some magazine by somebody that's got 3 neurons that they should drink distilled water, and so they're chugging distilled water all day long, and they can, you can get into some serious hypotonic hydration things. We used to challenge each other as kids to drink 8 glasses of water in an hour or something like that. We used to do crazy things, which are not crazy anymore. But what happens, obviously, if you increase the water concentration, okay, so the more water you have, the less solute you have. And the cell obviously has a lot of solute inside of it, okay? And so the cells are going to swell, especially the red blood cells. Anatomy and physiology one we talked about, where they could actually rupture because they swelled up so much. So you actually can have fluid excess, okay? And where you can get into problems there is obviously people who have kidney deficiencies or complete kidney shutdown. So you have to monitor their water intake, okay? You can get this excess water, pulmonary water, it's called pulmonary edema, or you can get a cerebral edema. You can get nausea and cramping. If you are a mountaineer, usually most people on Everest die, not from hypoxia because they climb with oxygen now, okay? But they die from pulmonary or cerebral edema. And because there's not enough air to get helicopters up to them, you have to bring them down to probably the lowest base camp that they're, maybe not the initial base camp, but one of the lower base camps, just to be able to get a helicopter up there. But that's usually what the problem is with people who die on Mount Everest, is they die from pulmonary and cerebral edema because of the altitude. And so that's one of the things they're always looking for if you decide that you want to climb Mount Everest. It's an increase, and so you also can get edema. We experience edema all the time. If you twist your ankle and your ankle swells up, that's increased fluid in the interstitial area. Also, you can get edema from another of other things. You can get if your heart is failing, you can get fluid down your legs because your heart's not pumping adequately, and you get hypertension. You can get kidney disease. You can get, obviously the lymph can get stopped up either from parasites or from cancer, things like that. And you can get an excess of fluid because if the lymph stopped up, remember one of the things that the lymph does is drain that, we filter out some fluid, but we don't bring everything fluid back in the renal system, and the lymph is responsible for getting that. So you can get edema, but like I say, the most likely cause that you and I see is we don't see the curve and we twist our ankle or something like that. Electrolyte balance, these are the cations, okay? We know what an ion is. An ion is an element or group of elements that have gained or lost electrons in the process has developed a charge, okay? A cation is a positively charged ion. An anion is a negatively charged ion. And so here, this is a group of elements that is an ion that has a negative charge. This is the bicarbonate ion, okay? This is the bicarbonate ion. Sodium, potassium, calcium, hydrogen, chloride, phosphorus, and the bicarbonate ion. Disorders due to electrolyte imbalance, hypernatremia, increased sodium, okay? Water retention, hypertension, and edema can cause hypernatremia, okay? Hyponatremia is if you ingest too much water. hyperkalemia, which is something that you want to monitor. You don't want to get a fast hyperkalemia. You can go into cardiac arrest. That's one of the medications that they put in when they do the lethal injections after they get the individual sleep, as potassium to have cardiac arrest. If it's slow, okay, you can have nerve and muscle less excitable, more like hypokalemia, and we'll go over hypokalemia in a minute. But hyperkalemia is an increase in potassium. This would be if you're not able to secrete potassium in the collecting tubule systems. So we're primarily talking about renal failure. Hypokalemia, depressed reflexes, irregular heartbeat. Most people that take diuretics have blood work done every 6 months to every year. So I'm on a diuretic, so they test my blood work to make sure that I don't get hypokalemia. That's one of the problems with a diuretic. Hypercalcemia, muscle weakness, cardiac arrhythmias. Okay, so too much calcium. In other words, your parathyroid is overactive. You have mobilized calcium from your bones. Okay. Hypocalcemia gives rise to tetany. Okay. If you have a total thyroidectomy or near total thyroidectomy, remember the parathyroid gland, which is on the back of the thyroid gland. There's 4 small parathyroid glands. When you're doing a thyroidectomy or near total thyroidectomy, you must identify and preserve at least one parathyroid gland. And what you do, they're a little bit different color than the thyroid, but what you do is you take a very small sliver of it and you send it for frozen section and get the pathologist to identify it, and then you implant it usually into the sternocleidomastoid muscle. Every person that has a thyroidectomy, every person that has a total thyroidectomy or near total thyroidectomy has a couple of amps of calcium at their bedside. Because if that parathyroid is not working, okay, they can get into hypocalcemia, and you can see the ultimate problem. I have never seen this when I was a general surgery resident. I've never seen a patient get tetany after a thyroid wasn't a whole, we didn't do a whole lot of those, but the ones we did, we always had a couple amps of count. You write it in the orders that you have a couple ounces of calcium at the bedside, actually taped onto the headboard or whatever, so that if you need it, it's there. Okay, but you can see they go into tetany if they develop a severe hypocalcemia. So that not only do they get blood work done on a fairly regular fashion that first night, okay, but they also have calcium there. Now, you have to remember, this is 40 years ago when I was a general surgery resident, so I don't know what they do now. They may do them outpatient, probably do outpatient. Acid-base balance. Remember, we have acids, we have bases, and we have a pH scale. Okay, an acid this is the Arrhenius definition. The Arrhenius definition. There's Arrhenius and Bronsted and Lowry, and then there's another one that we want to go into. But the Arrhenius definition of an acid is a substance that liberates a hydrogen ion in solution. And so in high school, you learn this. You have hydrochloric acid, you put it in solution, and since we're talking about physical systems, solution is water, and it dissociates into the hydrogen ion and into the chloride ion. The hydrogen ion is a cation, the chloride ion is an anion. Okay, so by the Arrhenius definition, which is the first definition, a substance that liberates a hydrogen ion in solution, okay, is a acid. The Bronsted-Lowry definition says a substance that liberates a proton donor is an acid. Okay, a substance that liberates a proton donor is an acid. Well, it's the same thing if you think about it. The element hydrogen has 1 proton and 1 electron. Has 1 proton and 1 electron. Its atomic number is 1. Okay, it has no neutrons. Its atomic mass is 1. Has 1 proton and 1 electron. If it becomes an ion, it has lost its electron. So what is it made up of? It's only a proton. And so when you talk about a proton donor in relationship to Bronsted-Lowry acid, you're still talking about the hydrogen ion, okay? So it actually covers both of them is in regards to the hydrogen ion. And so if you see the word a proton donor, you're talking about the hydrogen ion, because hydrogen only has one proton and one electron. If it becomes an ion, all that's left is one proton. A base is a substance that will accept hydrogen in solution, okay? They don't really go away. So the Arrhenius definition says that a base is a substance that when dissolved in solution gives a hydroxyl ion. This is a hydroxyl ion. There again, this is a group of elements. Remember, we have an element or a group of elements have gained or lost electrons and in the process of developing charge. Well, the hydroxyl ion is a group of elements, has oxygen and hydrogen, has a negative charge, okay? If you put this in aqueous solution, water, which will dissociate to, okay, into the hydrogen and hydroxyl ion, or any other type of thing, will combine with the OH and form water. So a base is a substance, by Arrhenius definition, that will dissociate into a hydroxyl ion and a cation, or in Bronsted-Lowry definition, will accept a proton, which means it will accept a hydrogen in solution. Acids and bases can be very strong or very weak, okay? A very strong acid completely dissociates, or near total completely dissociation. And the prototypic example is hydrochloric acid. Hydrochloric acid has 100% dissociation. So if you look in this beaker, we have placed hydrochloric acid in solution of water, and literally we have hydrogen ions and chloride ions. We don't have any hydrochloric acid anymore. We don't have any hydrochloric acid anymore. Okay, whereas here we have carbonic acid, okay? We have carbonic H2CO3, okay? And we put, that is a weak acid. So it will dissociate in solution, but as opposed to being 100% dissociation, it might be 20%, it might be 10%, it might be 5%, it might be 30%. And I don't remember what the dissociation constant, that would tell you what how much its dissociations is, what it is. But you can see we have some hydrogen ions, we have some bicarbonate ions, but we also have our carbonic acid. So a weak acid only partially dissociates in solution. A strong acid completely dissociates in solution. So if a strong acid completely dissociates in solution, we have only ions. If a weak acid partially dissociates in solution, we can have the neutral compound and we can have ions also, okay? pH is a measurement of the hydrogen ion concentration. It is the negative logarithmic scale, okay? pH is measured, okay, the hydrogen ion concentration, it goes from, I've never seen a pH of 0, so it goes from 1 to 14. 1 to 14 is the pH scale. The reason it's the negative log, if you take a log of a number less than 1, okay, the log of 100th is -2, okay? 10 to the -2 is 1 over 100. Well, log 10 of 10 to the -2 is -2. And so the reason they put a negative in front of the log for pH is to get rid, so they have a negative, so to get rid of the negative sign. So technically it's not a part of any kind of derivation of what the pH is. It's a method of getting rid of the negative in front of pH. So rather than saying stomach has a pH of -2.3, we say the stomach acid has a pH of 2.3. Or blood has a pH of 7.35 to 7.45, as opposed to if we didn't have the negative in front of the log, we'd have to say blood pH is -7.35 to -7.45, and so it would just make more confusion in the system. Okay, and so that's the whole reason there's a negative in front of the log. It's just to clean up the numbers. It has nothing to do with the derivation or anything. So once you understand that, then you can understand, okay, it's a negative. We're getting rid of that minus sign, all right? So if you have a high concentration of hydrogen ion concentration, because 10 to the minus 1, the negative log of 10 to the minus 1 is minus 1 is the log, and then the minus 1 is 1, okay? So 1/10 is certainly much more than 1,000th, and 1,000th is 10 to the minus 3, and that would be a pH of 3, okay? So the smaller in magnitude in the number in pH, the more acidic it is. pH of 7 is neutral, and pH of 14 is highly alkaline, okay? And so hydrochloric acid, straight hydrochloric acid is about 1, straight sodium hydroxide is about 14, and neutral pH is 7. Blood pH is 7.35 to 7.45 on average. Every singly number changes means a 10-fold difference. So every time a pH unit goes up 1, okay, so if it goes from 2 to 3, okay, or if it goes from 3 to 2, if you have a pH of 3 and it goes down to pH of 2, that means that that particular solution that you're measuring has a 10-fold increase in acidity or 10-fold increase in hydrogen ion. So if it was 4 going to 2, that means it would have a 100-fold increase in acidity. pH of 5 is 100 times more acidic than pH of 7. Normal pH for arterial blood is 7.35 to 7.45. So you get all these people on TV saying, well, we got to get you negative, and your blood's got to be negative. No, that's not right. Okay, your urine dipstick, they want to get you negative so they can get you in ketoacidosis, so they know you're burning fats. Okay, but and I was at a huge golf conference, 10,000 people plus, in Orlando one time, and the guy up there, the nutritionist, was saying the same thing, and I just went to the microphone, raised my hand, and I said, listen, you're talking about getting a pH of 6.5, person's going to be dead, okay? And then the chair of the department got up real quick and said, are you a doctor? I said, yes. And he said something to the lecturer, and that was the end of that. And so you have to take a lot of stuff. Now that you know stuff, okay, you can better interpret stuff. Okay, you can better interpret stuff. Like this TV commercial says, oh, well, you got stubborn belly fat, you can't get rid of it. Well, if you've ever seen the picture of the people in the concentration camps, they had no problems getting rid of stubborn belly fat. Okay, if you consume less calories than you take in, and you don't have a metabolic problem, you don't have a metabolic problem like hypothyroidism or something like that, you're going to lose weight. So take everything you hear and see with a grain of salt. Importance of maintaining appropriate pH. If you have obviously pH under 7, okay, that's going to lead to death. You got problems with disruption in the nervous system, the muscular system. Too alkaline leads to overexcitation, okay, resulting in convulsions and death. All functional proteins have an optimal pH for being effective. The optimal pH is usually in that range, 7.35 to 7.45. And so that's why you want to keep the pH in that range. And the body does a good job of that. And we'll learn how it does that. Proteins can actually become denatured and non-functional. If we got into the, where they become denatured, I think we'd be dead before that happened. But that's one of the problems. We denature proteins with heat when we cook eggs and proteins and stuff like that. And why do we need to get rid of this stuff? Because we make acid all the time. We make acid from metabolism. We can make lactic acid. When the fats break down, they make acid. And so we've got to deal with this constantly. Mechanism to control acid levels. There are 3 of them, okay? We've already studied one's the kidney, okay? And we know one also, we know the respiratory mechanisms, and we've went over the buffer systems, okay? So we got a buffer system, okay? We got a buffer system, we got a respiratory mechanism, and we got the kidney mechanism. And the kidney mechanism has to do, if you think about it, with the hydrogen ion, the bicarbonate ion. Okay, are we going to keep hydrogen? Okay, because we're too alkaline, so we're going to keep the hydrogen and dump the bicarbonate. Or in the opposite, if we're too acidic, we're going to secrete the hydrogen ion and absorb, okay, absorb the bicarbonate ion. So that's the kidney in a nutshell. Chemical buffer systems, one or two molecules working together that can quickly bind the hydrogen ion, okay? We make a lot of acids, so that's primarily what we're dealing with is with the hydrogen ion, okay? The bicarbonate buffer system, okay? We have carbonic acid and sodium bicarbonate, most important extracellular fluid chemical buffer system. So extracellular fluid, 35% of the fluid, two compartments, vascular compartment and interstitial compartment. I just keep saying it, keep reiterating, keep mentioning it. So these are the two, we have a whole lot of buffer systems, but these are the two most common. This is carbonic acid, this is sodium bicarbonate. With sodium bicarbonate, hydrochloric acid is a strong acid. Carbonic acid is a weak acid. Hydrochloric acid is a strong acid. Carbonic acid is a weak acid. We can combine a strong acid with sodium bicarbonate. If you've taken Tums or any of those things, you've taken, most of those things are sodium bicarbonate, calcium bicarbonate, usually sodium bicarbonate. And what they're doing, they're neutralizing. You're taking them because you've got acid reflux, or your stomach's feeling queasy, or you think you got a lot of acid in your stomach. And what you're trying to do is neutralize that acid. Well, this hydrochloric acid is a strong acid. It's going to completely dissociate into the hydrogen ion and the chloride ion. The hydrogen ion is going to bind with the CO3, the HCO3, and form carbonic acid. The chloride anion, okay, the chloride anion, the hydrogen cation, the chloride anion is going to combine with the sodium to form sodium chloride. So strong acid, weak base, weak acid, and a salt. Turns strong acid into a weak one, okay, and takes chloride and makes it a salt. This works because salt can be easily excreted, and it's a useful electrolyte. Carbonic acid can be indirectly controlled by the lungs. We'll look at that equation where you take CO2 and water, and that forms carbonic acid, and then carbonic acid can dissociate into the hydrogen ion and the bicarbonate ion. Kidneys can control the bicarbonate level. So with this simple buffer system right here, we can neutralize the strong acid. Most important. And now we have the phosphate buffer system, which is most important in the intercellular fluid buffering, okay? We have hydrochloric acid and we have sodium hydrogen phosphate, okay? And so the same thing here. This hydrochloric acid is a strong acid. We have a weak base, we have a weak acid, and a weak base, okay? Because this is an acid, because it's got an extra hydrogen ion, so it's going to donate that hydrogen ion. So it's an acid, but it's a weak acid, just like our carbonic acid. So we're going to go from strong acid to a weak acid. We're going to neutralize this hydrogen ion, and we're going to form salt again. Turns a strong acid to a weak acid, and takes chloride and makes it a salt. And this can help to control our phosphate concentrations. We can secrete the excess. We can monitor the salt. It can be excreted too, or secreted. They use excreted, but we learned secreted also. Then we have the protein buffer system. Most powerful source of acid-base adjustment. Three-quarters of all the adjustment in the cells. Remember, protein is in low concentration in the interstitial fluid, high concentration in the intercellular fluid, and high concentration in the intervascular fluid, but very low concentration in intercellular fluid, okay? A protein, remember, is made of amino acids, okay? An amino acid, if you remember the basic structure of amino acid, is a centralized carbon. It is an amino group, which is an NH2 group, is the carboxy group, which is a COOH group. It has a single hydrogen, and then has an R group, and it's that R group that determines the 20 different amino acids, okay? Proteins can give up a hydrogen if needed from that carboxy group, and they can bind a hydrogen if needed to that amino group which then becomes ammonia, okay? Due to functional groups, we have the COOH group. This is the carboxy group. This is the acid group. When we talk about amino acids, this is the acid group. This is the amino group, okay? So the carboxy group can give up this hydrogen, okay, decreasing the pH. And then this, because if we give up the hydrogen, we're going to increase the hydrogen ion concentration. Remember, pH is a measure of the hydrogen concentration. If we put more hydrogen concentration into the fluid compartment, you know, we're giving it up from the COOH, then we're going to increase the hydrogen ion concentration. We're going to decrease the pH. If we tie up this hydrogen ion, okay, if we tie up this hydrogen ion with this NH2 group, we then form NH3, the ammonia. Okay, this is the ammonia group, and so we can tie up hydrogen. And remember, these are two of the groups that are on each one of the amino acids: the carboxy group and the ammonia group, and then we have a hydrogen ion in R group. So this is the way that protein acts like a buffer. So I could see this as a short answer question, you know, maybe a 5-point question. Discuss the buffer systems in the body, okay? Or maybe just discuss it. Yeah, it might be a 10-point question. Discuss the three different buffers, the three different chemical buffer systems in the body. Respiratory mechanisms. So that was the chemical buffer systems, okay? There was a chemical buffer systems, the phosphates, the carbonates, and the proteins. Now we're going to talk about respiratory system. This is the quintessential equation that if you that you would have to memorize and you'd have to regurgitate on the test. And we are able to manipulate this, okay, to adjust pH. Carbon dioxide combines with water and forms carbonic acid. Carbonic acid then splits into the hydrogen ion and the bicarbonate ion. If we decrease respiration, if we don't breathe for whatever reason, we're intoxicated and we took too much tranquilizers or too many other pills or whatever, and we're not doing adequate ventilation, we're going to increase our CO2. If we increase our CO2, it puts a stress on the system. There is a principle in chemistry, you don't have to know this, but it's called Le Chatelier's principle. Says that if you put stress on a system, the system, because there's such thing as an equilibrium constant, the system's going to try to get to that equilibrium constant. Well, if you increase the concentration of CO2, you're putting stress on the system. So the system is going to go in this direction. Well, if it goes in this direction, you're eventually going to form more hydrogen ion. So if you're not ventilating, you're going to increase your hydrogen ion concentration. And if you do that, you're going to become acidotic. So this is a principle you need to understand, because I guarantee you, you're going to need to explain this. You're going to need to explain the respiratory mechanism, and you're going to need to use this equation. But if you're not ventilating for whatever reason, you could have COPD, you could have emphysema, okay? But you're not ventilating. If you're not, or like I say, you could have a decreased mental capacity. You're not arousable. You could be in coma. If you're not ventilating, you're increased the CO2 because you're not getting rid of the CO2. If you increase the CO2, this chemical system tries to relieve the stress. You've got too much reactant now. You got too much of one of the compounds on one side of the equation. So it's going to try to even out. Okay, that's what it's going to try to do. It's going to try to even out. Well, in the process of evening out, it's going to decrease, so you've already got an elevated CO2. It's going to try to decrease this CO2, okay? The way it does that is shift this equation to the right. When it does, we get an increased hydrogen ion concentration, pH goes down. Lungs respond to cerebrospinal fluid pH, which is directly related to blood pH. So this is the response. It's to CSF pH. We're not responding to blood pH, but they're directly correlated, okay? Blood acidosis stimulates increased rates and depths of breathing, okay, due to these particular areas, so that CO2 is blown off. So if you hyperventilate, okay, if you hyperventilate, okay, say you're acidotic, okay, or we test, say you are in a coma and we test your blood and you're acidotic and you're on a ventilator, we're going to increase the rate of the ventilation to blow off CO2, okay, to blow off CO2. If we blow off the CO2, so if we decrease this rate of CO2, then the equation is going to shift to the left. It's going to shift to the left. And that's going to, then we're going to have less of a hydrogen ion concentration, and we're going to go more towards the alkalotic side. We're going to raise the pH. So if you increase breathing, okay, you're going to blow CO2 off. And if you blow CO2 off, you're going to raise the pH. But alkalosis slows the rate of bleeding, okay? So if you're alkalotic, okay, we're going to slow the rate of breathing so that we can switch the system to the other way. So that's what we can do internally, okay? That's what we can do internally to adjust pH. We don't know it because that's on the subconscious level. That's on the subconscious level that we're either breathing less or breathing more, okay? On subconscious level that we're doing this to be able to adjust our pH. And we can also use it, use that mechanism in the ICU, patients on ventilators, okay, to take care, to be able to correct things if we need to. Excess renal and kidney mechanism. So this is, we have the chemical buffer system, we have the respiratory system, and now we have the renal kidney mechanism. And so these are the ways to adjust pH in the body. That's the big topic thing here. This is a big topic, adjusting pH. We can excrete or secrete, okay? We can excrete or secrete urine, the hydrogen ion, so we can secrete it into the collecting system, okay? If we need to get rid of it, if we need to keep it, we can reabsorb it into the peritubular capillaries out of the collecting system. Rids body of metabolic fixed acids, so we're talking about getting rid of it. So we've got these acids, okay? Remember, definition of acid is essentially the release of hydrogen ion. So if we've got acids or the products of acids, we can get rid of it by secreting it in the kidneys. This is the slowest of the mechanisms. The chemical buffer system is the fastest. It's not instantaneous, but very fast. The respiratory is the next fastest, and the kidney is the slowest, but it can work the hardest. Whereas the respiratory, you can only do so much. Okay, you can only slow the breathing down so low or raise it up so high. Okay, you can only do so much with the respiratory, or we as people, if we're doing it subconsciously, can only do so much. Okay. But with the kidney system, it's slow acting, but it has the largest capacity, and with somebody who has normal renal function, has the largest capacity to enact change. Act slowly, but the only system can regulate and renew chemical buffers that have been used up. So if we've used up our buffer system, we can get rid of stuff, and we can make a new we can get rid of the hydrogen ion, okay, off the carbonic acid, make a new bicarbonate ion. Key mechanisms: conserve filtered bicarbonate ions, bicarbonate resorption, generate new bicarbonate ions with excretion of either the hydrogen ion or excretion of the ammonium ion, excrete excess bicarbonate. So these are all things that we can do, okay? We can secrete, and so in the collecting tubules, we can secrete hydrogen against concentration gradients so that the urine can become very acidic. So in other words, if we need to correct an acidosis, we can secrete the hydrogen ion, even though it is already acidic in the urine, we can continue to secrete it, okay? And this is one of the pictures that you can look at. That's all it's doing, is we're preserving the bicarbonate, okay? And we're secreting the hydrogen ion. So hydrogen is pumped out into the tubules using the hydrogen pumps and binds with hydrogen phosphate. Bicarbonate is sent to the peritubular capillaries. Remember, the peritubular capillaries, that was the efferent arteriole out of the glomerulus that becomes the peritubular capillaries that surrounds the proximal convoluted tubule, the distal convoluted tubule, the collecting tubule, and the loop of Henle, or the descending and ascending limbs. And if it was in the juxtaglomerular glomerular nephrons, where it formed that long, straight area of capillaries, we call it vasa recta, where this is just a review, okay, of the things we talked about last week. That effect is to exchange the CO2 for a bicarbonate. This is a new bicarbonate. So I won't ask you to describe that mechanism. What I'll ask you to do is what capabilities does the kidney have to preserve pH? Okay, what capabilities does the kidney have to preserve pH? We can do the opposite. Okay, so in the last one, we were secreting hydrogen. Okay, we were secreting hydrogen in the process, making a new bicarbonate ion. In this one, we're going to reabsorb the hydrogen and secrete the bicarbonate ion. Okay. Blood pH is brought to the 7.35. Remember this 7.35, 7.45 range. Less than 6.8 or greater than 7.8, you're dead. Okay. Significant medical problems may persist, but blood pH remains normal thanks to compensation. We're able to compensate based on some of these mechanisms that we have. Okay. You may still have COPD. You may still have emphysema. You may still have pneumonia. Okay. One of the compensations we have with pneumonia, if the pneumonia is localized, is we're not going to perfuse that particular alveoli or section of alveoli or lobe of the lung, because we're not going to get any air exchange. So there's no sense in perfusing that particular thing, for that particular section for air exchange. Okay. Because we won't get any air exchange because of the fluid due to the pneumonia and infection going on there. Okay. Incomplete pH is adjusted, but doesn't get into that range. So we can completely compensate. We can bring it back into the range, or we can get incomplete. We can be adjusted, but not get back into the range. Respiratory compensation occurs in minutes, but maxes out in hours. Okay. That's what I was saying. We can respiratory, the chemical system is immediate. Respiratory is minutes, but maxes out. Hyperventilation, hypoventilation. That's literally the two techniques we have there. Okay. Renal compensation begins in minutes, but takes days to max out. Kidney tubules secrete hydrogen reabsorbed bicarbonate. Alkalosis versus acidosis conditions in the body. Respiratory measured by PCO2. So we can have respiratory alkalosis, respiratory acidosis. We can have metabolic alkalosis, metabolic acidosis. Okay. So those are 4 separate disease states depending on the cause. Okay. Depending on the cause. If we are inebriated, we're not ventilating. If we're not ventilating, we're not blowing off CO2. If we increase the CO2, we shift the equation to the right, more hydrogen ion concentration, increase the pH. Okay, that is a respiratory acidosis because we're not ventilating. If we're hyperventilating, we're blowing off CO2 to beat the band. We shift the equation to the left to try to make more CO2. That decreases the hydrogen ion concentration. We go alkalotic. Okay, same thing happens with metabolic. Respiratory acidosis, increased PCO2 above 45 due to inadequate movement of CO2 from the blood, inadequate and increased CO2, bicarbonate, and the hydrogen ion. Because remember that equation, CO2 plus water, it gives us carbonic acid, gives us the hydrogen ion plus the bicarbonate ion. So if we increase the CO2, then we're going to increase carbonic acid, then we're going to increase hydrogen ion. If we increase hydrogen ion, we're going to become acidotic, and that's from inadequate ventilation. Emphysema, pulmonary edema, damage to respiratory centers, obstruction airway, breathing muscle disorder. Compensation, renal compensation, increased excretion of the hydrogen ion, reabsorption of the bicarbonate ion. Because what's the problem? We're not breathing, we're not moving our CO2. CO2 increases, shifts the equation to the right, shift the equation to the right, increase hydrogen ion concentration. Kidneys are going to step in. They're going to secrete hydrogen ion into the tubules going out as urine. They're going to resorb the bicarbonate ion. So they're going to compensate for our respiratory acidosis. Ventilation therapy to increase CO2 exhalation, administration of bicarb. Respiratory alkalosis, PCO2 below 35. Overstimulation of inspiratory centers, stroke, severe anxiety. This is what happens to people in panic attacks, okay? If you've ever had a panic attack, you'll never forget it. And you pray you never get one. But if you have one, after you've had 2 or 3, you can sort of start to recognize what's going on, and you don't get so, I mean, you still get nervous, but you don't get so nervous. I've had panic attacks before. That's why I can speak from personal experience. Pain, high altitude, okay? Respiratory alkalosis, pain, high altitude, severe anxiety. Compensation, guess what the kidneys do? They decrease. Now we're alkalotic, so we want to add more acid. So we're going to not secrete/excrete hydrogen ion into the renal tubules, into the collecting system. We're going to reabsorb it, and we're going to dump bicarb, okay? Just the opposite treatment. Or if you or some of your friends have a panic attack, okay, you can have him to inhale, exhale in a paper bag. In other words, to rebreathe CO2. To rebreathe CO2. A lot, you probably don't know this, but a lot of famous actors, actresses, and singers, okay? Actors, actresses, and singers have anxiety and have panic attacks before performing. A lot of them used to take, or may still take, they take Inderol. Inderol is something that slows down your heart rate, because if your heart's not beating 180 times a minute, you're not nearly as panicky as you are, okay? And so a lot of them used to take Inderol. A lot of golfers used to take Inderol because if you're standing over a putt worth a house payment, are going to keep you on the tour for the next week. And they used to do that. Now that sports people can't take Inderol unless it's prescribed by a physician for a specific reason. But a lot of Adele talks about she was at the back door. She was going to leave a concert because she was in the middle of a big panic attack. A lot of people you wouldn't believe would have panic attacks before they perform. And so it's a very common, it's very common in people with people that are high performance people, that need to excel, need to get stuff done, need to push themselves. Don't have to be the top, okay? Don't have to be the top, but you keep pushing yourself, and it's very common. I think everybody I know my son has it, my mom had it, and I think my brother has it. So it's, it may be familial. My dad had it. Metabolic acidosis. So if you had it, it's a very common thing, okay? And so don't think it's anything bad. It's just a common thing. So that was our respiratory alkalosis and our respiratory acidosis, okay? Our metabolic acidosis, okay? Metabolic acidosis, hydrogen ion concentration. If it's acidic, that means we got a lot of hydrogen ion. We don't have much bicarbonate. So the bicarbonate ion, HCO3 negative, okay, level gets too low, below 22 milliequivalents per liter, causes pH to decrease. We don't have enough bicarb. Losses of the bicarbonate ion with diarrhea. So if you have severe diarrhea, especially in kids, okay, but you can get it in adults, okay, you can get a really bad case of bacterial or amoebic dysentery and get into a severe electrolyte disbalance, okay. Or bad with renal function, you can have a lot of acids produced, you can have failure of the kidneys, okay. Diabetes, excessive alcohol consumption. Compensation, what do we do? Respiratory compensation, okay. What respiratory compensation do we want to do? Well, what respiratory compensation do we want to do? We are in acidosis, okay. We would want to breathe faster. We'd want to blow off CO2, because if we blow off CO2, then here's CO2 plus water plus makes carbonic acid, and that splits into the hydrogen ion and the bicarbonate ion. Okay. If we blow off CO2 over here, we have decreased CO2. That shifts the equation to the left. If we shift the equation to the left, we decrease the hydrogen ion concentration. And so if we decrease the hydrogen ion concentration, then that causes us to to try to reverse the acidosis and become alkalosis. If you ever seen me lecture live, I keep my eyes closed a lot, and the reason I do that is it seems like I see pictures in my head, like I'm pointing out this equation. This equation's not there, but that's what I would see. I would see a picture there, and I talk from those things. And it's just a bad habit I have. I mean, I could never be a full-time public speaker because I keep my eyes closed about half the time when I'm talking, only because that's the way I see things. So you have respiratory compensation. Now we have metabolic alkalosis. What does that mean? Okay. Our bicarbonate levels are too high. They're above 26 milliequivalents per liter. Okay. And the pH increases. Alkalosis, less hydrogen ion concentration. Well, what do we want to do there if we're going to do respiratory compensation? Okay. Excess vomiting. Now, if you think about it, if we do excess vomiting, what is in the stomach? Hydrochloric acid. We are literally pouring, if we're throwing up, we throw up all night, we're throwing up hydrochloric acid, hydrochloric acid, hydrochloric acid, okay? And so we are depleting our body of hydrochloric acid. Diuretics will cause this, endocrine disorders, excessive use of antacids. There are some people, I was talking about Tums. I have a thing of Tums. But there are some people that literally pop Tums all the time, okay? Or whatever their antacids are. So they can become alkalotic, okay? Because Tums is literally bicarbonate, sodium bicarbonate or calcium bicarbonate with a little bit of flavoring in it, or they can become dehydrated, okay? So they're losing acid or they have excess of bicarbonate. We can do compensation, respiratory compensation. Well, what do we want to do? We want to increase our CO2. How do we increase our CO2? We slow down breathing, okay? If we slow down breathing, we increase our CO2. If we increase our CO2 over here, that shifts the equation into the right, and we form more hydrogen ion, okay? More hydrogen ion concentrate. Hydrogen ion concentration is the definition of pH, okay? Negative log of hydrogen ion concentration, so we become more acidic, okay? Giving fluids with electrolytes, and that's the end of this lecture. The few announcements I made